Hi there, my name is Maggie MacNeil, and I'm a postdoc in the School of Nursing. I'm going to talk to you today about my project tracing the impact of citizen and service providers on the design of a mobility intervention for older adults. So we know that partnering with citizens and community members in health research helps to make research more relevant and can impact the healthcare system positively. And we know that more and more researchers are doing this, and we know a little bit less about the impact of what engaged approaches to research look like. Embolden is an evidence-informed mobility promoting intervention for older people, and it's co-designed by a 30-person strategic guiding council, and that guiding council has health and social service providers from the Hamilton area, as well as citizens from Embolden's target neighborhoods in Hamilton. And the aim of my study was to evaluate the impacts of the co-design approach on different stages of research. And the way that I set out to do this was using a participatory approach to developmental evaluation. I worked with 4 older adults on the SGC, and they helped me to set the evaluation priorities and decide the methods we would use to capture data about those priorities. And so the key sources we used were a survey, 2 focus groups of the SGC, and secondary data analysis of meeting minutes from 16 SGC meetings. And we analyzed that data, myself and another coder, using in vivo 12. Some of the results that you can see here across different stages of research. So in the design stage, the SGC helped to decide how the SGC would work with the researchers, so setting terms of reference. They helped the researchers expand the SGC and include more diverse people. And they helped to set some labels and frame messages for older adults. So one in particular was the idea of speaking about healthy eating as opposed to nutrition, and little things like that with language all throughout the development of the trial. In the execution stage, the SGC determined the priority intervention features. So who would deliver the intervention, where the intervention would be delivered, what it would include. So we knew physical activity, healthy eating, system navigation, and social connection would be important parts of the intervention. And the SGC helped to operationalize those things. So the specific details around what the physical activity would look like. So a progressive program, what would the healthy eating look like? And they wanted to be sure that that was an interactive way to do that. Some of the other things they did in the execution phase were they helped us decide to move towards virtual engagement of the SGC. And that was in the wake of the COVID-19 pandemic. And really important contributions to the recruitment process for the trial, deciding key partners who could help display emboldened messaging, what that messaging would look like, what messages and images would resonate for older people living in these target areas in Hamilton. And although we are not completely in the knowledge translation stage yet, they still have made important contributions, including helping to design and refine the study website, contributing to peer-reviewed publications, designing infographics, research briefs, conference presentations, including this one. As you can see, my co-authors are all up there. In conclusion, this project shows that a strategic guiding council can have important impacts all across stages of research, and it contributes to a growing field of people who are evaluating the impact of engagement on health research. Thanks for listening.